Hi, I'm Brittney Baird, the Labor and Delivery Nurse Educator for AppGuardian. I'm here because for the past 20 years, I've had the best job in the world, helping moms and families have a safe labor and delivery experience. The key to that experience is education. Moms and providers exchange information and educate each other. Health providers learn about the mom's needs along with her medical history and current condition. The expectant mom learns about labor and delivery and what to expect. Most importantly, they both learn how the current condition of mom and baby will shape the labor and delivery experience. The more that the new team talks and shares information, the better decisions can be made together for mom and baby. This video blog, Basics with Brittney, focuses on topics related to labor and delivery. This segment is all about the basics of preeclampsia. Preeclampsia is a hypertension-related complication that can affect pregnancy, labor, delivery, and postpartum. Let's get the facts. There are 4 types of hypertension-related complications: gestational hypertension, chronic hypertension, preeclampsia, eclampsia, and chronic hypertension with superimposed preeclampsia. Today we are tackling preeclampsia. Preeclampsia is diagnosed whenever hypertension is combined with abnormal levels of protein in the urine or other abnormal organ function even after delivery. Preeclampsia is a serious condition that affects 5 to 8% of all pregnancies and has a 2% mortality rate. Once diagnosed, preeclampsia requires consistent prenatal and postpartum care. Though our focus is preeclampsia, it is important to mention eclampsia. Eclampsia is diagnosed when a patient with preeclampsia has a new onset grand mal seizure before, during, or after labor. The cause of eclampsia is not known. With that in mind, it is very important that we first understand preeclampsia. Now let's spend some time talking about risk factors, signs, and complications of preeclampsia. We can end with some discussion questions that can deepen your conversation with your care provider about this condition. First, the risk factors. Who is at greatest risk for preeclampsia? Women with complications prior to pregnancy, like chronic diseases such as diabetes and lupus, obesity, hypertension with a previous pregnancy, age of under 20 or over 40, or pregnant with multiples. All risk factors are important to discuss with your provider. Now let's turn to some signs of preeclampsia. They include sudden weight gain in 24 to 48 hours, swelling of legs, hands, or feet, shortness of breath or dizziness, nausea, vomiting, or abdominal pain, also headache or altered mental state, decrease in urine output, changes in reflexes, and lastly, changes in vision. These are some of the important signs to look out for. Contact your provider at the first sign of preeclampsia. Now let's talk about complications that can arise with preeclampsia. Our list highlights a few, but please discuss these and all complications with your provider to learn how they could affect you. The first complication on the list is reduction of blood flow to the placenta and baby. Oligohydramnios, a decrease in amniotic fluid, delayed growth in birth weight, placental abruption, the uterus and placenta separation, eclamptic seizures, death of mom and/or baby. The last complication we will highlight is HELP, which stands for hemolysis, the destruction of red blood cells, elevated liver enzymes, and low platelet count. As you can see, preeclampsia-related complications are very serious. Let's put together some items for a preeclampsia discussion with your provider. Along with what we have already talked on risks, signs, and complications, it is also a good idea to find out what interventions are taken to prevent preeclampsia or to treat it once it appears. And of course, emergency care. What should you do and how quickly should you do it if you notice signs of preeclampsia? After getting some information, check that you have the correct meaning and also that your provider understands you. To find more discussion questions and strategies, check out AppGuardian online. You can also find my blogs there on hypertension and other labor and delivery topics. For the latest on preeclampsia, visit preeclampsia.org or acog.org. Thanks for watching.